Today our class is about tibia bone, and tibia bone is little larger like femur. So we will divide the tibia bone into two parts, upper end and lower end, and today we will discuss about the upper end, most important for 5 marks question. It is most frequently asked question in the exam point of view in the university board exams. Next, coming to the point of tibia. See, tibia is the medial and large bone of leg. See, always compare the tibia with radius because it is homologous with the radius bone. Tibia is homologous with the radius bone. Next, tibia is the medial, that is tibia, this is tibia and this is fibula. Fibula is lateral bone and tibia is medial bone. This is posterior region, this is anterior surface. Okay, tibia is medial bone as well as large bone of the leg. It is the large bone of leg. See, the width of the tibia, head of tibia is, upper end of tibia is very large. Okay, next coming to the side determination of the tibia. See, side determination, upper end is much larger than lower end. See, the upper end is much larger than lower end. Next, the medial surface of the lower end projects. That means the medial end, if it is the medial end of the lower end projects little downwards like this. See, little downwards like this. This projection is called medial malleolus. We will discuss about it while studying in the lower end, while studying about lower end. Medial malleolus. Next, this is the anterior border. The anterior border shaft is prominent and crust-like. It is curved. That means the anterior border of shaft is curved like this and terminates below at the anterior border of medial malleolus. Ila curve ayi untadi. Ekka terminate avutadi ante at the region of medial malleolus దగ్గర terminate అవుతుంది. This is about shaft and this is the side determination, and the anatomical position is completely in same as that of this side determination, so no need to discuss about anatomical position specially. And coming to the upper end, coming to the main point, upper end. See, this upper end is expanded from side to side. Side to side means from here to here. This is called side to side. This is how we will study. So we call it as side to side to form two large condyles. Okay, అంటే upper end side to side form అయ్యి two large condyles form చేస్తుంది. ఆ two large condyles ఏంటి అంటే this is medial condyle, this is lateral condyle. This is medial condyle, this is lateral condyle. This is medial side of the bone, this is anterior surface, this is lateral side of the bone. Okay, next, the upper end contains medial condyle, this one, and lateral condyle and intercondylar area. Here in the posterior region we can see clearly this is lateral condyle, this is medial condyle, this is intercondylar area and tuberosity. This is tuberosity. These are the 4 points that we will discuss in the upper end of tibia. Next, first medial condyle, and one of our follower asked about how to draw the diagrams. I am telling now, again I am repeating the same. See, observe the diagram, how I am using a single diagram to the entire question. Okay, observe carefully how I am using a single diagram to the entire question. This is the medial condyle. See, draw the diagram like this and label the part of medial condyle, write about medial condyle and draw the same diagram, label the part of lateral condyle and write about the lateral condyle. Okay, this is medial condyle. Medial condyle is larger than lateral condyle. See, it is larger than lateral condyle. Next, its superior surface articulates with medial condyle of femur. So while coming to the posterior surface, we can see clearly this is the medial condyle. I will dark with this blue ink. This is medial condyle. This medial condyle on the superior surface, it articulates with the medial condyle of femur bone to form knee joint. Okay, these condyles are clearly visible in posterior surface. It is not visible in the anterior surface. So observe these posterior surface diagram, so it will be easy to remember. Next, this is the central portion of this is the central portion of the medial condyle. This is the central portion of medial condyle. This central portion is concave and comes into direct contact with the medial femoral condyle. See, this is medial condyle. This central portion is concave and it directly connects with the medial condyle of femur bone. Directly connects with the medial condyle of femur bone. Okay. Next, the peripheral part is flat. See, peripheral means outer layer. It is flat and it is separated from medial condyle by medial meniscus. Okay, it has meniscus, medial meniscus here. It is separated from the medial femoral condyle, medial condyle of femur by medial meniscus. Next, the lateral margin of articular surface is, that means this is the lateral margin of articular surface. The lateral margin of, like this, the lateral margin of articular surface is raised to cover. See, observe the diagram carefully. It is raised like this. It is raised like this to cover the medial intercondylar tubercle. This is the medial. See, we can see in the anterior surface the medial. See, the lateral margin of articular surface is raised to cover the medial intercondylar tubercle. So it is invisible in the anterior surface. Next, posterior surface of medial condyle has a groove. See, here we can see a groove on the medial condyle of posterior surface. Next, anterior, this is the anterior, this is the posterior. Anterior, this is the anterior. Anterior and medial surface are marked by numerous vascular foramen. That means this is the anterior surface, this is the medial surface. So on anterior medial surface, I will draw with this clearly. This is the anterior surface as well as medial surface. On the anterior medial surface, there is numerous, that means large number of vascular foramen. Foramen means hole, vascular means where the vessels are passed, that means arteries or veins. Arteries gan veins gan pass ayye hole ne vascular foramen antamu. Adi akkada anterior and medial surface lo manaki chaala ekkuva kanipistayi. Okay, this is all about the upper end of medial condyle of the femur, tibia. Next, coming to the lateral condyle of tibia. This is the lateral condyle of tibia. Next, it overhangs the shaft more than medial condyle. See, it is more overhanged like this to shaft. Medial condyle just comes like this, and that means medial condyle ela vachesthundi, but lateral condyle vastari baga vangi vastundi. Overhanged means if it is the house, this is overhanged. This area is called overhanged if it is the house. Okay. Next, the superior surface of articulates the superior surface. It is this is the superior surface of lateral condyle. It articulates. We will see clearly on the posterior surface. This is the superior surface of lateral condyle. I will draw this with blue ink. This is the superior surface. This articulates with the lateral condyle of femur, as same as like that of this medial condyle. Next, the articular surface is nearly circular and posterior inferior aspect. That means this is the posterior region. Inferior aspect means kinda. Posterior inferior aspect of lateral condyle articulates with fibia. See here, this is the posterior region. This is the inferior region. Posterior inferior region lo fibula anedi articulate avutundi. This is fibula. Fibula articulates with this tibia. Next, the fibula facet is flat. That means this is tibia facet is flat and circular. It is directed downwards. See, it is directing downwards, backwards and laterally. Next, superior-medial to the fibular facet, the posterior surface of condyle is marked by a groove. Okay, marked by a groove. Next, the anterior aspect of condyle bears, that means this is the anterior aspect, this is the condyle. The anterior aspect of the condyle bears a flattened impression known as Gaddis. Gaddis, Gerddy apostrophe S gut is tubercle. Gut is tubercle. I'm sorry with my pen. Gut is tubercle. Okay. I repeat again. The medial aspect. This is the anterior aspect. The anterior aspect of condyle bears a impression known as gut is tubercle. This is the impression. This is called gut is tubercle. Okay. This is about the lateral condyle. Lateral condyle is similar to the medial condyle. So while studying this medial and lateral condyle, compare with each other. Next, coming to the intercondylar area, this area is called intercondylar area. This area is roughened area on superior surface. Okay, this area is roughened area. This area is smooth area. This area is roughened area. This area is narrow area. This part is elevated to form intercondylar eminence. This is elevated to form intercondylar eminence, which is flanked by medial and lateral intercondylar tubercle. Flanked means pattukovatam. Okay, which is flanked by, that means ఈ medial condyle and lateral condyle అనేది ఈ ఇంట్రాకాండల్ ఎమినెన్స్ ని పట్టుకుంటాయి. సో ఈ ఇంట్రాకాండల్ ఏరియా అనేది పైకి బల్జ్ అవుతుంది. సో ఇంట్రాకాండల్ ఎమినెన్స్ ని మీడియల్ అండ్ లాటరల్ కాండైల్స్ ఏం చేస్తాయంటే పట్టుకుంటాయి. ఓకే, దిస్ ఇస్ అబౌట్ ద ఇంట్రాకాండలర్ ఏరియా. Next, coming to the tuberosity. This is tuberosity. Tuberosity, simply tuberosity located at anterior aspect as well as upper end of tibia, anterior and upper part of the tibia. Next, it forms anterior limits of intercondylar area. That means this tuberosity ఏం చేస్తుంది అంటే ఈ ఇంటర్కాండలర్ ఏరియా ఇక్కడ వరకే ఉండాలి అని చెప్పి ఒక లిమిట్ పెట్టేసి దీనివల్ల ఇంటర్కాండలర్ ఏరియా అనేది అక్కడితో ఆగిపోతుంది. సో దిస్ పార్ట్ ఆఫ్ it forms an anterior limit of the intercondylar area. Next, inferiorly it is continuous with the anterior border of shaft. This is the inferior area of the tuberosity. This continues with the anterior surface of shaft. Next, this tuberosity is divided into upper smooth area. Upper it is smooth area and lower it is roughened area. Lower area is roughened area, upper area is smooth area. Next, epiphyseal line passes through the, that means if it is the tuberosity, it is the roughened area, it is the smooth area. The epiphyseal line passes between these two parts. Epiphyseal line passes through these two parts like this. Epiphyseal line passes through these two parts. Okay, that means between rough surface and smooth surface. This is all about the tuberosity and upper end of the tibia. We will meet again tomorrow. Thank you all.